get started. I'm Jeannie Rosner. I think there are some people that haven't been here before. Welcome to the newbies. Raise your hand if this is your first salon, please. Oh my God. Awesome. Welcome. Welcome. We have these events once a month. We're doing them all here now. I'm trying to alternate with talks and cooking events. Today happens to be kind of a talk cooking event combo, which is really awesome. My mission really is to educate and empower us all to be healthier, and hopefully to spread that to our parents or the older generation and to our younger generation, in hopes also for like our planet to actually be healthier. So that is my main message. I am constantly learning. I'm actually going to be interacting with Annie for 4 days. My brain is going to be just firing synapses constantly. I mean, my brain is going to be so happy and so healthy after these days. Hopefully it will continue. So Annie Fenn is a retired OBGYN who currently lives in Jackson Hole, Wyoming. We got connected through a mutual acquaintance. Acquaintance for me, I think more of a friend for you. I mean, she's my friend, but I don't really know her that well. And we started following each other on Instagram. So social media to me is like, I love it. I'm having a lot of fun with it. I post a lot, but I enjoy it. So we were following each other and we would comment on each other's recipes and whatnot. And one day I posted to Annie, I'm like, this looks amazing. It would be great to cook with you. She's like, okay. And so, and that's how this all happened. So Annie has clearly tapped into something that we are all very interested in. Annie retired from her career as an OBGYN 10 years ago and went on this culinary crusade where she travels the world, learns all really amazing culinary techniques, and then she teaches that. She's teaching at Rancho la Puerta. She just came back from Italy teaching, and she's just all over the place. She has a website, brainhealthkitchen.com. She's also very active on social media, so follow her, please, at Brain Health Kitchen. And yeah, so that's Annie. I welcome all of us, our brains to fire.
I have never felt so welcome coming into a community where I don't live to give a talk as I have here. I mean, really, really. I mean, Jeannie has been amazing. Patty McClung is a friend of mine from cooking at Rancho la Puerta together. And when she found out I was coming to the Bay Area, she emails me and says, "You can stay with me." She's like, "I'll give you my car." And I have never felt so welcome. So her husband, Alan, makes me coffee at 6 a.m. She stocked my refrigerator with blueberries and almond milk and everything I could possibly need, dark chocolate, and makes sure I goes for a walk every day even though I'm busy. And I just can't thank all of you enough. So I'm really looking forward to meeting all of you during the salon, during the demo, and also at the cooking classes we're going to be doing. So our topic today is cooking for better brain health. How many of you, be honest here, how many people here love to cook? And how many people, you cook because you have to, but you really don't have that much time? And how many people would rather just eat out when it comes right down to it? So it's a mixed bag. We're mostly cooks, but just like you guys, I don't have a ton of time to make everything from scratch. So I just want to let you know, even though my topic is about cooking, this is really more about eating. This is more about brain health. This is more about just awareness of what you can do to protect the aging effects of certain foods on your brain. And we're going to talk about lifestyle things as well, too. So just a couple things about me. I think Jeannie pretty much covered it. I practiced as an OBGYN for 20 years. The first 7 years were solo. That's why I got to retire early. So much gray hair. so much lack of sleep and brain damage from that. So when I retired, I didn't have any lofty goals to start a cooking school or anything like that. I really wanted to fulfill my duties as a full-time soccer mom to these two guys. And that's when they were 10 and 12 years old. And so I basically had this feeling like, I want to be home. I want to be making breakfast. I want to be driving to soccer matches. And I want to be managing my kids' soccer team. So that's one of the reasons I retired. And then, of course, 3 months later, I'm like, okay, I need something to do. So I went back to school. This time I went to culinary school. And I kind of pieced together my culinary education all over the world. I did spend a stint at the Culinary Institute of America in San Antonio, Texas. That was my formal training. Most of the other ones were in Mexico and Italy and places like that. I have 2 4-legged children as well, Orzo and Olive Oil, the baby. We call her Livy. And this all came about around 2015. I was starting to read a lot of the data about how what we eat affects whether or not we get dementia. And I was particularly interested in this topic because my mom was starting to show signs of dementia. And I was starting to delve into the literature and figure out what I can do to help my mom. I had this aha moment. I was writing a newspaper column about food and health. And I'm like, no one really knows about this data, that things that you eat or don't eat can have a huge impact on whether or not you get Alzheimer's later. So in 2015, I pretty much put my entire focus into cooking and writing about preventing Alzheimer's disease with food. And that turned into a cooking school that I started in 2017, which I could travel, as Jeannie said, all over the place to give classes in church basements and community centers and cooking schools, wherever people have me, in people's homes. I'm now at the point where I've had almost as many cooking students enrolled in my school as I've delivered babies. 1,000 each. So that's kind of cool. I stopped OB when I was at 998. So I'm still looking for those two like Good Samaritan deliveries I'll do on the side of the road somewhere in Wyoming. So my current passion is to spread the word. My message really is this: we don't have to get Alzheimer's. There is an Alzheimer's epidemic coming. We're all kind of becoming aware of that, right? So a lot of talk about brain health. You can't open up the New York Times without reading about this, right? But it's not inevitable. And saying that you can prevent Alzheimer's is something completely radical that 5 or even 3 years ago, most people would not say. So the cooking school, just one thing about my cooking school, these are a bunch of students I've had throughout the years. The thing that surprised me when I launched a cooking school that's focused exclusively on preventing cognitive decline was the different ages of the people that came. And it's not all women. It's almost 2/3 women, 1/3 men. And I get people in their 20s and 30s and 40s who are concerned about brain health. Maybe they have a relative with Alzheimer's, like a lot of us do, or it's touched their lives somehow. Maybe they had a brain injury that's sports related. That happens a lot in my community where adventure sports are really common. So I've had a wonderful diversity of different ages and different kinds of people coming through the school. Okay, so this is our agenda for today. I'll try to cover as much as I can. I want to talk a little bit about women and Alzheimer's, because I had a feeling this was going to be a mostly female group. So we're going to talk about that. I'm going to talk about the science that I use to back up my cooking school. Because I'm a physician, I'm very much evidence-based. I don't present a lot of data that's not evidence-based. So I'm going to run through some of the studies that I really rely upon. We're going to talk about the 10 brain healthy food groups and the 5 brain unhealthy ones. We're going to talk about what we drink, and I'm not just talking about alcohol, but I am going to talk about that, how that affects our brain health. And also a little bit about feeding a healthy gut microbiome, because that's really important, right? We all want healthy guts. So we all know that Alzheimer's is increasing. Right now, there's 5.8 million Americans living with Alzheimer's. But look at the projection in 2050. They've already changed this. This is 2019 data, but the 2020 data is going to be almost 15 million at 2050. So we are looking at a lot more people getting Alzheimer's. It's not so much that Alzheimer's disease is increasing. We actually had a small decrease in the blip of Alzheimer's in America, but the sheer number of people going into these age groups is going up, right? We're mostly baby boomers here. It's the boomer effect, just like everything else. So at the age of 65 now, your risk of developing Alzheimer's in your lifetime is 1 in 10. And at the age of 85, it's 1 in 2. So who's at higher risk, men or women? How many people think women are at higher risk? And how many people think men? It's actually women. Yeah. I mean, I'm not saying that Alzheimer's is a women's disease. It's a disease for everybody. But women are especially vulnerable to getting Alzheimer's. 2/3 of all Alzheimer's victims are women. 16% of women over 71 have Alzheimer's, compared to 11% of men. So why do you think that would be? There are theories. We can go through that. Well, some people say it's because women live longer than men. And that's partially true, but that doesn't explain the whole thing. There is something called survival bias, and this is looking at Alzheimer's from the viewpoint of cardiovascular disease. So, men succumb to cardiovascular diseases starting in their 50s and 60s, and it's not so much true now because we've taken a lot of advances in cardiovascular management. But if men get through not getting a heart attack at midlife, then the men that reach older age groups are actually healthier and sturdier and have healthier brains. That's the selection bias. Does that make sense? Another reason is women have less higher education than men. It's true. And we'll talk about cognitive reserve, which is a term some of you may be familiar with, but it might still be new to some of us. But cognitive reserve is really important for preventing Alzheimer's and building a more resilient brain against Alzheimer's. And then, of course, there's estrogen. What's the effect of hormone therapy and estrogen and going through menopause on making the brain vulnerable to Alzheimer's? This is a very hot area of research right now. Why are women more vulnerable, especially if they go through an early menopause, and especially if they have a lot of symptomatology around menopause? And then the fourth thing that's really important is that diagnosis is delayed. I saw this with my mother. The standardized testing, the cognitive testing for cognitive decline, such as Alzheimer's and other dementias, it turns out that women are really good at doing well on these tests, even though they have a cognitive decline. And it may be that women have different verbal skills than men, like more superior verbal skills than men, that's what they say. But we're seeing this. So now there's actually different tests being developed for men versus women so that they don't fall through the cracks. And the reason this is important is because the earliest stage of Alzheimer's is called mild cognitive impairment. And there's a lot of studies now showing, what can you do to someone who has mild impairment to keep them from getting into more overt Alzheimer's. And that's so key because it's a difference between living alone with some help and living in an institution. If you look at all those numbers that are projected, if we're going to have a little bit of dementia and still be living in homes with our families with help, we want to make sure we can slow it down. Any questions about that? Yes.
So would you recommend hormone replacement therapy?
Well, it's a very complicated question with a really long answer. So we can talk about it in the Q&A. Yeah, sometimes. Yes.
Just is food, can it counteract the loss of sleep over years and years when you have little kids or just when you have stress and you don't sleep? Is food that powerful?
Yes and no. Well, let's look at the food data and then we'll revisit that too. So let's talk about diets. Has anyone here ever been on a diet? I don't really advocate diets, mostly because I have no willpower and I could never stick to one. But these are just some of the diets that are out there. Do we really know what's the best diet for your brain in terms of preventing cognitive decline? We're getting closer, but I can't say we know exactly for sure. What about vegan, vegetarian, or whole food plant-based? Yeah, that's probably a very brain healthy diet, all of those. Although if you're vegan, you have to be very strategic about getting certain nutrients you might miss that are important for your brain. But there's not a lot of data on veganism or vegetarianism and dementia risk. And there's not much data on whole food plant-based either, unfortunately. I'm talking about long-term studies on large populations of people, seeing if they get dementia or not. But I'm guessing that, yeah, the really smart vegans and vegetarians are probably doing just fine. What about Paleolithic? Anyone paleo anymore? Done? No longer kaput? That's good. I was never a fan of that. What about low carb, high fat? Anyone doing that? No? Lots of friends. Yeah, lots of friends are doing that. Ketogenic, keto flex. Everyone sort of knows what ketogenic is. Yeah. Data for Alzheimer's disease? No data. Although keto flex is the diet that it's a spin-off of ketogenic that uses a ton of supplements and some other things, and intermittent fasting is part of it. And that's being studied to treat people with Alzheimer's disease, to see if their symptoms are improved. So you may have heard of a gentleman named Dr. Dale Bredesen, who's at the Buck Institute in the Bay Area. He's actually taking Alzheimer's patients and changing the way they eat and seeing if they get better. And he has anecdotal evidence that this is true. So he's out there saying that Alzheimer's can be reversed. Very controversial, yes.
So you limit your intake over 10 or 12 hours a day?
Yes, fasting is definitely part of it. And fasting is a lot of key issues with fasting that could be advantageous. Yes?
I just wanted to clarify, when you're saying Alzheimer's disease, are you talking Alzheimer's specifically and not all dementias?
Well, thank you for bringing that up because there is a difference between Alzheimer's disease and dementia. So dementia is the umbrella term of all the things that cause cognitive decline. And Alzheimer's disease in the US and most other places is 70% of all dementias. So there's other types of dementia, right? You can get dementia because you have cardiovascular disease and you get little tiny strokes inside your brain that makes your brain shrink. You can get dementia from Parkinson's disease. You can get it from Wernicke's encephalopathy. You can get it from some frontal lobe syndromes. So 70% is Alzheimer's. Another 20, maybe 30, 25% is cardiovascular related. And this is the really interesting part. 50% of all Alzheimer's patients on autopsy actually have evidence of cardiovascular disease in their brain. So they really go hand in hand.
Right. So my point is everything you're presenting to us and what you're going to talk about with your diet really applies to the larger umbrella.
Basically. Because a lot of these things are tools to reduce your risk of cardiovascular diseases as well. Pescatarians, any pescatarians? Great diet. Could be the most brain healthy diet on the planet. Yay, yay, Patty. I like pescatarian. What about flexitarian? Any flexitarians? I'm a flexitarian. That means 90% of the time I follow a plant-rich diet. 10% of the time I eat high-quality meat, chicken, fish, high-quality full-fat dairy products. If I go out to dinner with friends, I don't really obsess over what I'm ordering, although I want to avoid certain unhealthy foods like we'll talk about. It just gives me flexibility to really enjoy life and really enjoy food with my friends and my family without making it, some sort of eating disorder. The way I look at it. I love food too much to cut out any food groups. Gluten-free. A lot of people are still gluten-free, right? Yeah. Plant paradox. Anyone follow the plant paradox program? That's when lectin, they're saying that certain vegetables that are botanically fruits are toxic to you and giving you unhealthy gut and therefore dementia.
What are your thoughts on that?
Completely unproven. Yes. Selling a lot of books. You see it all over Facebook. Yeah, if you take the author's name and you put it into PubMed, which is how physicians and other researchers look at medical data, there's nothing there. It's a really interesting theory. I've read both of his books. It's a very interesting theory. And even I'm like, wow, I shouldn't be eating so many beans. It's not proven and I don't believe it. Weight Watchers, it's a great diet for weight loss. Lots of data on it. What about the SAD? Anyone know what that is? The Standard American Diet. Nobody here eats like that, I'm sure. The Mediterranean diet we'll talk about. The DASH diet is a diet to reduce hypertensive disease. It's very important. And then the MIND diet. Has anyone heard of the MIND diet? Yes? No one's heard about the MIND diet? Yeah. No, it's not my diet, but I think I like it a lot. Yes?
I just want to ask one quick question as you go through all this.
Yes.
Let's say you're 65 years old and you change your eating. Is there any data out there that actually says that it's not too late?
I have a slide for you. I have it exactly for you. I'm so glad you asked that question. Okay. Okay, write down your questions. Write down your questions, people. So I'm going to go through some of this data. Some of it I'll go through pretty quickly, but we can fill in the blanks later if you're interested. I don't want to give you way too much scientific data. But when I design my cooking classes and create recipes, I'm choosing ingredients and cooking methods based on data. It's based on science, what the studies are saying. And there's a huge body of data now that shows that what we eat and how we eat actually can prevent the deterioration of your brain as you get older. Radical, right? And we all need that. And there's also a large body of data that shows that the way we eat can improve our cognitive function now. So not only, maybe you're not worried about getting Alzheimer's disease when you're 70, but improving memory and other certain cognitive functions. That we all need, right? We all need that now. So I'm going to talk about the Mediterranean diet, the MIND diet, the finger study. Anyone hear that? No. That's the one. Patty knows all those. The Blue Zones research. Have you heard of Blue Zones? Yeah. Yeah, we'll talk about that. And then the brain food pyramid, I might not have time to go over. These are some of my students in Jackson Hole. Every June I have a potluck in my backyard. You can see the Tetons in the back. Where I live. We do this program in Jackson called BrainWorks. It's a 7-day dementia prevention program where I teach cooking classes and do the culinary curriculum. I work with a cognitive health specialist who's an internal medicine doctor. And it's a boot camp on all the things you can do to prevent cognitive decline. And anyone who's ever been to BrainWorks, which now there's a couple hundred people in our community, they're invited to my house for a potluck. And it gets very competitive with their newly acquired cooking skills. And they're all on Instagram now, sharing their dishes with me. And it's just great. And I love having friends of all ages in my community. It's probably one of the nicest things about starting the cooking school. I love being buddies with all these guys. Okay, let's get into some of the data. Before we talk about food, I want you to be aware of some things that came out in the literature this summer. So this is brand new. It came out of the Alzheimer's Association in July that was held in Los Angeles. And one of the key studies came out of the journal JAMA, the Journal of the American Medical Association. And they said that adopting 4 or 5 healthy lifestyle favors reduced the risk of Alzheimer's, of dementia by 60%. So we all have had this feeling, there's all this data that if you meditate or if you get more sleep or if you exercise, then your risk of dementia is going to be less. But now this was a study of 600,000 people over 8 years. It's a huge study. And it is observational, but it is prospective, so it's got all those good factors in it. So I want you to be aware of that. We'll talk about what those lifestyle factors are in a minute. The other thing about that came out this summer was that along the same lines, adherence to a healthy lifestyle was found to reduce the risk of Alzheimer's in people that had a genetic mutation for it. So you probably know that the Alzheimer's has a genetic mutation associated with it. And I'm talking about the late onset Alzheimer's that people tend to get after the age of 60, not the really horribly, horribly tragic early Alzheimer's that starts in your 40s. I'm talking about late onset. But they showed that people that adhere to a healthy diet, they could reduce their risk by as much as 32%. These are people with genetic mutations for Alzheimer's disease. Very, very key, because this is something that we've hoped to have come out of the literature that just happened. The third thing is a higher cognitive reserve through formal education and cognitive stimulation reduced dementia among people exposed to high levels of air pollution. I don't know if you've been following this, but people who live in areas with microparticles in the air, they've been shown to cause brain damage and early Alzheimer's. And now they're showing that if you have high cognitive reserve, then that mitigates against air pollution-caused brain damage. Very, very important study. So this is just me giving a talk at some friend's house in Boulder. You can see they all have Rancho la Puerta aprons on, because I met all of these people at Rancho la Puerta. And cognitive reserve is, does anyone want to describe it for me? What is cognitive reserve?
Taking more classes when you're older.
Taking classes. It's all of you sitting in this room right now on a beautiful day, and I know you could be doing 100 other things. It's pretty much your capital. It's your intellectual capital that you build up over the course of your lives. It's the ability for you to continue to learn even though you're no longer in school. It's your ability to morph and do different things at different stages in your life. It's challenging your brain. And challenging your brain like this seems to build resilience. Even if you get Alzheimer's, like Alzheimer's diagnosed by autopsy is amyloid plaques and tau tangles and other different proteins that accumulate in the brain that kind of just like jam everything up. But even if you do develop that, you're less likely to have any symptoms. So cognitive reserve is super important. I'm not worried about any of you because you're all here. Your cog reserve is great. The fourth key finding was that smoking, people who smoke actually get Alzheimer's symptoms very much earlier than people that don't smoke. This is really not that much of a surprise, except that they started to show symptoms in their 40s.
Is that secondhand smoke too?
They didn't look at secondhand smoke. It's so hard to study. But this is smokers.
Sometimes I wonder if that's part of the genetic link,
Yeah.
if you grew up with.
Yeah, you wonder. And this becomes important now because, if you have a teenager, you know that everyone's vaping, and we have to start talking about smoking again. I never used to talk about smoking in my talks, but I'm starting now because it's really important. The fifth thing that was important is that this is just in women, but alcohol use disorder significantly increased the risk of dementia, 3-fold. And alcohol use disorder, I'm not an expert in this, but it's somewhere between moderate use and being an alcoholic. It's heavy alcohol use. Yeah, so we have to be very careful as women to make sure that we're not drinking too much. And that, by the way, is a friend of mine who has a winery in Tuscany. That's the Jackson Hole Mountain Resort. But she is now CEO of the Jack's Hole Mountain Resort. So she's got a side job. This is that study I just talked about in JAMA. What are the 5 lifestyle factors? You guys can probably guess what they are. Yeah, brain healthy diet, yay, number 1. At least 150 minutes a week of moderate to vigorous exercise. We're all good about that, right? That's the minimum, because that's only like 20 minutes a day. I would like to see people exercise for at least 30 minutes a day, if they can, most days. Not smoking, light to moderate alcohol intake. You don't have to drink to be brain healthy. There are people that don't drink that, like the Seventh-day Adventists in Loma Linda, California. They don't drink and they have a very low rate of Alzheimer's. But there's a lot of studies on light to moderate drinking that we'll talk about. And then cognitive reserve. This is a statement I think is very powerful, and I just want you to remember that even though there's no proven cure or treatment for Alzheimer's, a large body of research shows that combining healthy habits promotes good brain health and reduces your risk of decline. So like I said, 5 years ago, saying that we could prevent Alzheimer's would have been preposterous. We're not really saying that we can prevent it. What we're talking about is delaying it. And there's a difference. So if you get Alzheimer's when you're 85, there's a difference between that and when you get it when you're 95. Because those last 10 years of your life could be really vital. You could have great-grandchildren, you could still be traveling, you could still be working and writing like a lot of people in this community are in their elder years. And it's also the difference between being in an institution and living at home. So we're saying we're pushing it off. It's not saying that we're doing anything magical by curing it or preventing it, although someday, hopefully, we'll know how to do that. This is a picture of some girlfriends and I. We have a hiking group every Thursday, and it's so cognitively healthy in so many ways. Not only do we do really hard hikes in the Tetons, like this one, but we always have lunch. It's called We'll Hike for Lunch. In the winter, it's called We'll Ski for Lunch. And it's so good in so many ways because, as you guys probably know, having a tribe of girlfriends is probably your best prevention against any kind of mental health problems in your life, right? Okay, the Mediterranean diet pyramid. I know you're all familiar with this, right? Mediterranean diet. When I was a really busy OBGYN and people would come in for their annuals and we would talk about everything, and 30 minutes into it, I'd have to dash out the door and go deliver a baby or something, and someone would say, "Oh, Annie, what do you think I should eat?" And I had a copy of this table in my desk drawer, and I would just give it to people, like, eat this. And it turns out I wasn't so far off, luckily, because this is still the best diet, the best studied diet in terms of preventing cardiovascular decline as well as cognitive decline. And if you think about the standard American diet, the SAD diet, it's basically an upside-down Mediterranean diet pyramid. Like, Americans eat a lot of meat, right, at almost every meal. Sweets. I mean, Americans are drinking sugar, eating sugar, sugars in all of the processed food, an inordinate amount of cheese and eggs and poultry. Fried chicken is incredibly popular here. We don't eat much fish or seafood, especially like in middle America. And Americans aren't very good at eating, all those plant-based foods. So Americans need to do better. So when you look at the population studies on the Mediterranean diet, we knew over 15 years ago that there was a 40% reduction in Alzheimer's disease in those that follow the Mediterranean diet over a standard American diet. So that's pretty big, right? That's pretty great. We know that there are 30% less heart attacks and strokes in people that follow the Mediterranean diet. So we'll talk about what is it that is so important about that. Newer research shows that you can improve cognitive function on the Mediterranean diet. And now just the SMILE study, I don't know if anyone has heard of this study. The SMILE study is incredibly important. They showed that following a Mediterranean diet helps people with anxiety and depression get better 25% of the time, as an adjunct to the other things they're doing, like medication and therapy. So now we know the Mediterranean diet is something we should be teaching, especially all the 20, 30-somethings, teenagers, to eat better who have anxiety and depression, because that's another big epidemic that we're dealing with. Okay, this slide is for the one who asked the question about what can you do when you're 65. So one of the great advances that we have MRI data looking at brains and how they react to certain foods. And if you see on the left, this is someone who has followed a Mediterranean diet. And on the right is someone who follows a Western diet. And the Western diet, you can see that the brain is shrunken away from the skull. There's more black areas, which is just fluid rather than gray matter. And their brain is basically shrinking. Brain atrophy is the term for brain shrinkage. And that's what we see when people are on bad diets. And we're starting to see this on MRI data. This comes from a study of 468 brains on brain volume of Mediterranean versus the standard American diet. And the one study I'd love to talk about is the Scottish study. They looked at 562 of these MRIs in people in their 70s. So this is like saying, you know, I'm 73, Annie. What can I possibly do that's going to help my brain? And they showed that if you start a Mediterranean diet, even in that age group, and you follow it for 3 years, they showed not just a plateau in their brain volume, but improvement. And apparently the Scottish diet is a lot like the American diet, from what I understand. I've never been there, but I think that's true. So you can improve the volume of your brain. And you know what? Why is volume so great? Volume is neurons, it's synapses, it's connections, it's all of the things that makes us smart and have good memories and quick and have good executive function, all of those things. And it's our memory center. It's all the things that are really important to us we want to hold on to. And they also showed the converse. The people that didn't follow their Mediterranean diet had brain shrinkage over time. This is the work of Dr. Lisa Mosconi. Do you know the book Brain Food? Great book. Big fan of hers. Okay, the finger study, just real briefly. So this was a study out of Finland in 2015, 2016 that came out. They looked at, okay, what if we put people on a Mediterranean diet, we make them exercise, we reduce their cardiovascular risk factors, like their high cholesterol and their hypertension. We get them to meditate a little bit, because in Finland, that's not such a big thing, I guess. And then we follow them over time and see, you know, how does their cognitive function improve. This is actually my pediatrician, Dr. Little. He's now one of my BrainWorks students and alumni. Yeah, so he was there when both my kids were born. He got me out of so many jams when I was an OB, I can't even tell you. As you know. But I adore him, and he's aging super well. So this was over 1,000 people. They studied him for 2 months. These people were at high risk for dementia because they had cardiovascular risk factors. So you know that if you have risk factors for heart disease, then you have risk factors for dementia. And if you reduce your cardiovascular risk factors, then you also are reducing your risk of dementia. That's really important. So they did all these things. And they didn't follow them long enough to see if they actually got dementia or not. That would take more like 5 years of study. But after 2 years, they showed that they improved 25% in their cognitive functions, especially processing, speed, and executive function. So I think that's pretty great. 25%, I'll take it. They also looked at their telomeres. You guys know what that is? Those are the ends of your chromatin, of your DNA. It's like it's been described as the caps on your shoelaces. And if they unravel, then and your telomeres get shorter, it's associated with less longevity or shorter life. The longer your telomeres, the longer your life. And they were actually able to show that following this regimen increased the length of their telomeres, which is sort of a standard now with all tests now on longevity. They're looking at telomeres. It's another one of my BrainWorks alumni. I love him. He's an organic farmer. I have no idea how old he is. I love him so much. Okay, blue zones. I'm going to go through this quickly because I think we all know what the blue zones are. The 5 places on Earth where they have more centenarians than any place else. Can anyone name the 5 places? Sardinia, which is where I took this picture last month. Costa Rica. Loma Linda, California. Greece, Icaria, Greece. Japan, Okinawa, Japan. So Okinawa, Japan. Icaria, Greece. Loma Linda, California. The Nokara Peninsula in Costa Rica. And Sardinia, thank you. I traveled through Sardinia last month because I'm just obsessed with centenarians. And it's so much fun. So they have a manifesto. You can just read it here. It's a lot of what we're going to be talking about. I'm just going to make up some time here. They follow the Mediterranean diet. A big part of the Blue Zones manifesto is they socialize a lot. I took this picture in the town where I was staying in Sardinia, and at 5 o'clock, like clockwork, All the men come out of the homes and they go down to the town square and they sit around and they talk and they smoke, and then they go to the bar and they have little glasses of wine, and they socialize on average for 5 hours a day. Wow. That's thought to be one of the secrets. I don't, maybe it's that 4 out of 5 thing. I mean, I don't know. Everyone there smokes so much, I couldn't even believe it. Okay, let's talk about the MIND diet study. MIND stands for the Mediterranean Intervention for Neurodegenerative Delay. And so it's a hybrid diet of the Mediterranean diet, which we all know about, and the DASH diet, which was developed to lower hypertension, which is a huge risk factor for Alzheimer's disease. Huge, especially hypertension at midlife. If you have high blood pressure at midlife and you get it down under normal, like under 130, now they're saying, systolic, then it reduces your risk of dementia later. And if you have high blood pressure at midlife, it increases your risk of dementia later. So this paper came out of Rush University. It's written by Dr. Morris on the left. She came out and did a brain health class with me, and we had a ton of fun. But she's fabulous. She's probably the most knowledgeable nutritional epidemiologist in the world, and she just studies the brain and cognitive function. So there's a huge wealth of knowledge. So this is almost 1,000 participants, 58 to 98 years old. They followed them for almost 4 years, which is long enough to see if they get Alzheimer's or not. And they compared these 3 diets. They had people follow this MIND diet score, and at the end of the week, they would tally up how much of these foods they ate. Some of them are good and some of them are bad, as we'll talk about. And they would get a total score trying to get to 15 every week. And no one gets to 15, by the way. Even Dr. Morris, when I asked her, I'm like, how often do you get 15? Because I actually tallied my diet for a while, and it's, 13, 14, maybe sometimes I get to 15. She says it's nearly impossible to be perfect, and that's a big point of some of the things, we're talking about. You don't need to be perfect, you just need to be eating well most of the time, 90%, 95% of the time. So the results were amazing even to her. She was surprised when she saw that people that followed that MIND diet most strictly had 53% less Alzheimer's after 4.5 years. And that's just 4.5 years. Like, you follow that out, which they're doing now. It's an ongoing randomized controlled trial with data to come out in a couple years, and we'll have more data. The cool thing too is the people that cheated on the diet and only followed it about half the time, they had a 35% reduction in Alzheimer's. Because who doesn't cheat on a diet, right? And they also, like the finger study, they had improved cognitive function, which was really, really wonderful. So put another way, following the MIND diet was like increasing the brain span or the longevity of your brain by 7.5 years. And these are all the different parameters of cognitive function that they looked at. So Dr. Morris divided the foods into 10 brain healthy food groups and 5 brain unhealthy food groups. And do you want to go through those? Yeah. Okay. You can probably guess what some of them are, because they overlap with blue zones, and they overlap with the Mediterranean diet. Okay, and this is all in your handout too. Okay, so leafy green vegetables. Dr. Morris took leafy green vegetables and made them their own food group. And every choice made for this diet that was put together is based on dozens of studies that came before it. One study that's really powerful about leafy green vegetables is if that's the only thing you do is eat a cup of dark leafy greens every day, then it can increase the brain longevity that you have by 11 years. Just that one thing.
Does asparagus count as leafy green, or is it?
I don't think an asparagus is a leafy green vegetable.
So it's the kale.
Yeah. Yeah. Is there asparagus in there? Yeah. Sorry. Yeah. Yeah. The kale.
Okay.
Yeah. This is from Italy.
I didn't know.
So at least every day, okay? And that's 1 cup raw, which is about a 1/2 cup cooked. Other vegetables, 1 or more servings every day. So you got your leafy greens and your veggies. That's easy, right? Mm-hmm. We all do that every day, pretty much. Perfect. Berries. Berries is its own food group. Not surprising, right? We know that blueberries are good for you, blackberries are good for you. 2 or more 1/2 cup servings every week. And there's been tons of independent study on just berries. Like if you just increase the berries in your diet, especially if you're a woman who is in their 50s, 60s, and 70s, you will have improved memory and less dementia. Yes?
Are frozen as good as fresh?
They are, although I do advocate getting organic berries because berries are very porous. And if you're consuming a lot of pesticides, it causes oxidative stress in the brain, which goes against what you're trying to do in the first place. But sometimes frozen berries are the best option. And I buy frozen berries all the time. I always have a bag in the freezer. Absolutely. Nuts. The snacking on nuts is healthy. Everyone knows that, right? So 5 quarter-cup servings a week is what you should shoot for. And that could be in the almond milk that you drink or in the nuts that you snack on or how you cook. Yes?
What if you're anaphylactically allergic to nuts and legumes?
You just leave that out. Because you're not going to be very brain healthy if you're having an anaphylactic reaction. Yeah. Most people who are allergic to nuts can eat seeds. Seeds, like sunflower seeds, pumpkin seeds, sesame seeds, and some of those have a lot of the same brain healthy properties. Okay. Yeah. And legumes, I don't know. I would increase, legumes are really beneficial in terms of their fiber. Fiber is a huge thing with brain health and health in general. I would just make sure you're getting a lot of fiber otherwise.
Yeah.
How important is it to get organic nuts?
Oh, moderately. Like I would say that I try to buy organic, but I don't always because I use so many nuts in my kitchen. And so I do my best, but I don't always buy all organic nuts. It gets so expensive, and I can't always find them. Yeah, and you can't even basically find an organic cashew in America. They're all from other places, and then you wonder if it's really organic. It's tough. I struggle with that. But when I make nut milk, I soak the nuts. We'll see how I do it. We're going to do that in the demo. I soak them and soak them and soak them and strain them, and I figure I'm leaching out as much as I can. Beans, 3 or more half-cup servings a week. Does that seem like a lot to people? No? Yeah, beans are good. Beans are good.
Cooked? 3 or more half-cup.
Yes. How much fiber are we supposed to eat? Does anybody know?
Lots.
He said 25. Yeah, between 20 and 36, depending if male or woman. Yeah, and most of us are not getting enough fiber. The fiber is really important because it lowers cholesterol and it also reduces the uptake of blood sugar from your bloodstream so that it doesn't spike your insulin. And we know that if you have chronically high blood sugar, chronically high insulin, it does increase your risk for Alzheimer's. Yes?
Just quickly, I'm assuming that what is important is to have repeated exposure, let's say multiple times a week, half a cup rather than eating like 5 cups.
Because of the fiber issue, I would say yes. Whole grains, 3 or more half-cup servings a day. Is that surprising? Aren't grains bad for your brain? What about grain brain?
What are some examples of whole grains?
Whole grains would be farro, or wheat berries, quinoa, even though it's a seed, it's a pseudograin, brown rice, black rice, the ancient wheats like emmer are considered whole grains. Wheat berries, farro, oats.
What's that dish on the slide?
Oh, so this is a dish I made in Italy last year. I think, Sharon, were you there for this one? At Sempre Sano, we made a quinoa chia seed pudding. Yeah. With grapes from the vineyard. So the thing about whole grains, if you're allergic to gluten, you're sensitive to gluten, or you don't, gluten doesn't agree with you. This is you don't want to eat any wheat products. But whole grains themselves have a ton of vitamin E and a ton of fiber. So don't throw out all of the grains in your diet if you're gluten sensitive. You don't have to eat grains to be brain healthy, but there are a lot of benefits to having some of them in your diet. Let's see, they're filling, yes.
So you are in disagreement with Dr. Perlmutter on that?
I think he's partially true. I've read his books, and I've followed a lot of his information, read his papers. He's a neurologist who wrote Brain. I always forget. So what he did is he took a bunch of people who were neurologically very unhealthy and had neurodegenerative diseases. He got rid of all the white foods in their diet. He got rid of their white rice, their white flour, their everything, their potatoes, all that stuff, and they started to improve. But I would submit that get rid of all those junky processed foods, but whole grains are actually really good for you. And it's a staple in the Mediterranean world, and of all these centenarians, this is pretty much what they eat. Fish, no surprise, right? As long as it's not fried. The interesting thing about the Mind diet, they did not show a benefit in more than 1 fish serving a week. So you don't need to eat gobs of fish for your brain. I mean, the Mediterranean diet says 2 to 3 servings a week. Most Americans, well, unless you live in California, I guess, have a hard time with that. So 1 or more servings every week. Chicken, 2 or more servings every week, not fried. And why chicken? Why is that brain healthy? It turns out it contains particular brain health nutrients, lutein and choline, which are also found in eggs. Yeah, so if you're going to eat meat, chicken is a good one. Of course, you know, there's chicken and there's chicken, yes.
Is there a delta between dark meat and light meat for the choline?
I'm not sure about that. There's a difference in saturated fat content.
Yeah.
But I don't know about the choline. Yeah, it's a good question. Yes?
Regarding fish, if you don't eat fish, is the point to get the omega-3, or is there another?
Basically.
Okay.
Basically, yeah.
Do you recommend the algae? Do you recommend taking an omega-3 supplement if you don't eat fish?
Maybe. I mean, the data on fish oil supplements and omega-3 supplements for cognitive health is that there's no benefit.
And the algae supplements?
Mm-hmm. But if you don't eat any fish, then maybe you take an algae supplement. I mean, I might do it if it was me, but it has not been proven in population studies, and it's been looked at a lot. Yeah, I mean, all the data on fish oil supplements for cardiovascular health and brain health is not reassuring. So I'm going to keep going, and we can take more. Olive oil. So the Mind Diet uses olive oil as our primary cooking oil. And what's so special about olive oil? Why is olive oil so good for you?
The ratio of omega-3 to omega-6.
Mm-hmm. Yeah, it has more omega-3 fatty acids than omega-6s. Omega-3s are anti-inflammatory in general. Omega-6s are more inflammatory. You need both, but you want a healthy ratio. Most Americans have a diet that is like 16-fold higher in omega-6 fatty acids than omega-3s. So we want to change that up by being really strategic about the type of oils that we consume. Some people don't consume any oils at all. Are there any plant-based people here? No oil at all? Yeah. But whole food plant-based is no cooking oil. Yeah. But I think that olive oil has some particular, it also has polyphenols, which sets it apart from all the other oils. It actually has polyphenols, which are phytonutrients from the olives that are brain healthy in certain ways.
Can you talk a little bit about the type of olive oil that should be purchased?
Can we talk about it in the cooking demo? Because I'm going to cook with olive oil a little bit.
There's avocado oil.
Yes. The short answer is I love avocado oil for my high heat cooking and olive oil for everything else. And sometimes I mix the two. But we'll talk about it in the demo. I'll show you how I use olive oil. And then red wine is actually the 10th brain healthy food group, which is really good news if you love red wine. But then the really bad news for that is it's only 5 ounces a day, which is a really small pour. And that's compounded by the fact that the Mind Diet trial is a randomized controlled placebo trial that's ongoing now with the Mind Diet. This was an observational one. They took people and they looked at how they ate over time. The Mind Diet trial is taking 300 people, putting them on the Mind Diet, 300 people putting on a similar but different diet, and then following them. And Dr. Morris decided to take out the red wine, so it's no longer a brain healthy food group. Now there's only 9. And she said it was just too complicated with Americans. Like the alcohol data is that a little bit of alcohol is good, but a lot is not. And Americans really have a hard time with that. Yes?
One thing that's not on that list is all other fruits, like apples or watermelon, and I'm just curious, I mean, are those just kind of fine but not particularly good?
It's really interesting because berries was the only one that made the cut because it's so high in anthocyanins, which are a type of phytonutrient that actually helps scrub the amyloid plaque from your brain. So it has a particular brain health function, and also they're high in fiber. So you know there's something called a glycemic index of foods. Everyone knows about that? Okay. The glycemic index of food is totally pertinent to this whole discussion. So fruits that are on the low glycemic index, like berries, are going to be more brain healthy. So anything in that category I think is fine. But they didn't find any data to support eating those fruits. Yes?
And I didn't see any soy.
Nope, they didn't talk about soy. Yeah. We'll talk about soy because I'm going to cook with soy. Yeah.
A lot of women also deal with bone health issues.
Yes.
And so what is she doing, or what are the other recommendations? I know you can get some calcium from leafy vegetables, but Dairy is really the way.
This data doesn't pertain to bone health. But in my opinion, if you're following a brain healthy diet that's also good for your cardiovascular system and you're eating a mostly plant-rich diet, it's going to be good for your bones. But you have to look at your risk factors individually to see if you need a supplement or not, or take estrogen therapy. Okay, you ready for the 5 brain unhealthy food groups? So between being a soccer mom and opening my cooking school, I worked as a food writer and wrote for the newspaper and went to events. That's where I took this picture. Okay, fried and fast food, less than 1 serving each week. So the MIND diet is not an elimination diet. It's not saying you should never, ever have a chicken wing. It's not saying you should never have a hamburger. It's just saying, could you please just eat less of these foods? These foods are not good for your brain, and they may accelerate the aging of your brain. And so I still eat fried food, but I want to make sure it's fried in something that's not like really junky and full of inflammatory things. Like I was just in Italy, and the first thing I did when I got there is I ordered a fried artichoke. Right? And they fry them in olive oil, and you have to be careful when you go to restaurants. They use terrible oils, some restaurants. And it's okay to ask them what kind of oil they're using. I think that's something we should all be asking more. So less than 1 serving each week. And then fast food. Who eats fast food anymore? But maybe our kids do. I mean, just really try to dial back on that because they've cut some of the worst oils ever. Red meat, less than 4 servings a week. And a serving size is 3 ounces. Meat was in the news this week, right? Anyone have any confusing questions about meat? Cutting back on meat is good for your health. No one disagrees with that, especially brain health and cardiovascular health. And then there's meat, and then there's, high quality meat. So you have to be very strategic. All the meat you eat should be very knowledgeable, like where it came from, what that animal was eaten, and whether it was ethically treated. Butter. I'm really sorry to tell you about this one, especially you, Betsy. The MIND diet takes a really hard line on saturated fat because there are independent studies showing that a diet high in saturated fat increases your risk of Alzheimer's disease. So less than a tablespoon a day, which is really not that hard to do. I do this, and I'm a big baker, but I've learned to bake with olive oil instead of butter for a lot of things. And now when I do eat butter, it seems like so amazingly rich, and I can't even believe what it tastes like.
If you bake with olive oil, is the conversion?
It's not the same. It's tricky. Yeah, so one of the things I obsess over is finding recipes that I can use olive oil with instead of butter. It doesn't always work, but I have got some good cookie and cake recipes.
Yes. What about using ghee instead of?
Yeah, so ghee is probably going to be the same in terms of saturated fat. It's just the butter without the solids. Yeah, and people love using ghee, and it's a high heat cooking oil. But I would still go by these guidelines. So there's butter, and then there's butter. The European brands like Plugra and Lurpak and Kerrygold is another one. Those cows are fed only grass. And GMOs are not allowed in Europe. No, I'm saying if you buy butter, you're going to be saving so much money on butter that you need to buy the best butter at the market. And then this one on the bottom, that's the butter from the farmer's market. And why is it so yellow?
Healthy cow.
Yeah, it's the ALAs. It's the omega-3 fatty acids that the cows eat. And that's from my biodynamic farmer who's got the healthiest grass and the healthiest cows. So yeah, enjoy your butter, but maybe not have it out on the kitchen counter all the time. Cheese, less than 1 serving a week of cheese. That's really bad news, right? Okay, but I have good news for you. The MIND diet trial, Dr. Morris increased this to 2 ounces. She took away the wine. Yes?
Does it include goat and sheep cheese?
So that's a whole other issue. So the MIND diet was really done on a cohort of people in Middle America, the way most people eat. And and I know that there's cheese and then there's cheese. So most Americans are getting their cheese from a big bag of shredded that they keep in the refrigerator at the ready all the time, right? And they're smothering it on everything. Or they're eating pizza, or they're eating cheeseburgers. But if you want to get some really high quality cheese with a healthier casein protein, like goat or sheep's milk has a casein 2 versus a casein 1, it's going to be less inflammatory in general, and it's going to be, basically a healthier cheese. Choose really good cheese when you eat it.
Pre-shredded cheeses too have a coating on them?
They do, and they've got all sorts of artificial things in there, and blah blah blah. But yeah, eat good cheese. I eat tons more cheese than that, but I eat a lot less cheese than I used to, believe me. I do not snack on cheese anymore. Like sometimes I'll serve cheese for dessert is a really special thing. Yeah. Pastries and sweets, less than 5 a week. We can do that, right? Yeah. Yeah. Totally. So a lot of what I do is, besides helping people figure out, all the myriad of nutrition data, is looking at brain healthy cooking techniques. And this is kind of new, that there's certain ways you can cook your food that will make them more brain friendly than other ways. So I would love for everyone to slow cook more. So lower temperatures at longer time are less likely to cause products in the food that are damaging to your brain. I like people to braise. Cooking things in liquid is less likely to create compounds that are damaging to your brain. Avoiding high heat, direct grilling, things like that. Sealing, frying, boiling, or frying in a pan. All of those things create things that are bad for your brain. So like years ago, we learned that the char on steak is carcinogenic, and it is. There's things in there that are carcinogenic. But that char also contains advanced glycation end products, or AGEs, aptly named AGEs. Has anyone heard of this? Because this data is kind of new, but I think it's really important. If I had to guess, I would say the AGEs are the things in processed food and fast food and fried food that's basically making Americans really sick. And AGEs are glycotoxins. They happen when you apply high heat and a sugary substance to food. And think about things that come in packages like crackers and certain breads and potato chips. All of these things are like high heat cooking. Seed oils. Like think of sunflower seed oil, some sesame seed oils. They have to apply really high heats to these foods to process them, to turn them into something they can sell and have shelf stable. But these AGEs are actually found to accumulate in the neurons of Alzheimer's patients. But there is a correlation between the AGEs in your system and whether or not you get dementia later. Sharon, you had a question?
Yeah, so what about roasting vegetables or you're charring vegetables maybe in a pan? Is it comparable to meat or?
So this is such a good question because there's two things about cooking techniques. One is choose a technique that's brain healthy, but if you choose food that's low in AGEs right off the bat, you're gonna be way ahead of the game. So I roast my vegetables. Like if my Brussels sprouts get kind of burnt, I'm not gonna stress over it. I might use avocado oil instead of olive oil because it has a higher smoke point. But if I'm using something like a Brussels sprout that's so low in AGEs to start with, as opposed to a piece of meat is high in AGEs, and you slather it with barbecue sauce, which has sugar in it and all this other stuff, then you're racking up AGEs very quickly. So you can use these higher, like I'm grilling, obviously my vegetables right there, and I got grill marks on my peaches. But I'm not gonna worry about that because I eat a plant-rich diet and I'm gonna be cooking this way with a lot of my plants. Yes?
When you mentioned the AGEs and crackers, does processed bread that you buy, do they have to do the same thing to bread? Like sliced?
They do. So when I went to culinary school at the CIA, I learned about the Maillard reaction and how that makes browning. It's like this chemical reaction that makes things brown and tasty, like when you caramelize onions or you sear a piece of fish. But it's that searing, it's that browning that you get on the outside of the bread. Okay. Yeah, high quality bread, I don't worry too much about it, honestly, because I want the grains. And there's vitamin E in there. Yes?
A quick question on grilling. Is gas grilling versus wood grilling, or is it all the same?
Well, I like a wood grilling. I actually changed out my grill for a Traeger, which is a wood pellet grill, because you can get the heat down really low. So I do a lot of indirect grilling. Another great thing to do is have a grill basket, and that will also decrease the contact you have of the grills with the food. Also keep your grill really clean, because that stuff on your grill, yeah. So you don't want that ending up in your brain. Yes.
How about using convection when you cook?
Convection's great. Yeah, convection's fantastic. It's kind of like a moist heat.
And a wok? Does that count as the?
Oh, I mean, if you like to walk and you're eating a lot of vegetables, go for it. But that's a high heat method. And I use it too. But in general, we're getting away from high heat and going to more slow heat. Sous vide is also really good. If anyone has a sous vide. Pressure cooking is also really good. Yes?
Are you at all worried about the plastic contaminant of sous vide cooking now?
No, because I have BPA-free bags. So I don't know. I mean, I get food grade bags that are BPA that I get from my sous vide. I don't use it a ton, but We eat a lot of wild game in Wyoming, so you have to have a sous vide. Believe me. Okay, we need to talk about the microbiome. All these pictures Jeannie and I took at the farmer's market. Was that yesterday? I feel like I've been here for so long. So, this is a really complicated topic. The best thing that I've read lately is if you want a healthy microbiome, you should eat 30 different types of plants every week. It's not that hard. Okay, get out a notebook and just start doing it and see what you can get up to in the next 7 days. If you come to cooking class, we've got you totally covered. And why is that? Why is diversity so important?
So would an herb count as well?
Yes.
Okay.
It feeds different microbes.
Different microbes. The soil has different, we have a gardener here. The soil is key. And that's one reason why they say that our food is no longer nutritious, because our soil is so poor. So you want to buy organic if you can, but it's not always feasible, but it's going to be healthier soil. And also there's a difference between prebiotics and probiotics, right? We all know what probiotics are. Prebiotics are the things that the bacteria in your gut eat. So you want to have a variety of vegetables, and you want to cook them in a variety of different ways, like some raw and some cooked. Raw veggies will get to the lower part of your colon and feed those gut microbes that are located there, whereas cooked veggies will get the ones in the upper GI tract. So, you can eat raw if you want to, everything, but I like, do a variety of things. Don't always do the same thing.
Broccoli and kale are always supposed to be cooked to get the good nutrients.
There's sulforaphane in broccoli and other cruciferous vegetables like that, and cutting up the broccoli is what releases it.
Oh. So it's not the cooking, it's cutting.
But when you chew it up,
Maybe cutting it up.
Yeah, and maceration too. Yeah, like as you'll probably learn, I'm not a big fan of smoothies because, their smoothies are fine, but I think people need to eat their food too, not just drink it. Organic, we already talked a little bit about this. This is a fact that the pesticide residue in our food causes oxidative stress in the brain. It has been proven. Color. So choosing color in your plants is really important because this is the thing, like dietitians have been saying eat the rainbow forever, right? But what does that even mean? The different colors are different plant pigments, and those plant pigments are phytonutrients. And we know about the hundreds of phytonutrients like carotenoids and lycopene and anthocyanins, which are key for brain health. And I bet there's hundreds we don't even know about yet. So choosing a variety of food, different colors is what you want to do. So just, don't always get the white eggplant. Get the purple one sometimes. Cauliflower. Yeah. Okay, what about eating out?
Go for it.
Have you noticed that food is getting better everywhere? You live in like food mecca, but even when you travel. So this is one of my I have another ski group that's a downhill ski group on Tuesdays, and this is at the Jacksonville Mountain Resort. And this is like what we have for lunch at 8,000 feet there. So food is getting better everywhere, but just seek it out. One thing I like is when you order in a restaurant, think about your plate. Half the plate should be plants. Half the plate. It's easy. That means getting maybe a main dish salad and a protein on the side. I know you guys already do this, but if you do it on a regular basis when you eat out, you can feel a lot better about the food that you eat. When you're looking at a menu, I make it a game. I think about the Mind Diet 10 brain healthy food groups, and I see how many can I hit.
That sounds like so much
expensive
fun.
Some entrees will have like all at once. I almost never order entrees. It's like kind of rare, but. And then olive oil instead of butter. If they bring you bread and butter, you can just, they're stopped doing that now, right? Yeah. In my town, in the good restaurants, they bring crudité instead. There's a crudité, revival, which is really fun. You want to ask what's in the salad dressing. Even the house olive oil in most restaurants is half olive oil and half canola oil. And there's good canola oil and there's canola oil that I would not want you to eat. And so you can say, what's in your salad dressing? Oh, that's okay. Just bring me some olive oil and vinegar, or just bring me some olive oil and some lemon juice and lemon. That's what I would do. The salad dressings are deceptively unhealthy. You can choose meat, chicken, and fish strategically. We talked a little bit about this. Fish is really tricky, as you know. I use the Monterey Bay Aquarium app on my phone. My grocery stores now label it based on Monterey Bay's guidelines. You guys already all know about that. And then drinking strategically. How much do we drink when we go to a restaurant? It's hard. They keep pouring your wine glass, or you have a cocktail, it's just good to pay attention to it. Okay, what about sweet drinks? Are you aware of this data out of Boston University? It was a couple years ago. 4,000 participants, pretty powerful. Observational data, though, which is not as good as a randomized trial. But they looked at artificial sweeteners and showed that if you're in the 45 and up age group, your risk of stroke was increased with each artificially sweetened drink that you consumed in your diet. And if you're over 65, your risk of dementia went up by the same amount.
So if you have a parent who drinks diet drinks like that,
oh my God, get them off of it.
Would you prefer they have, water with lemon or something? But would you ever say to have something like sugar in your tea, like are you having a hot cup of tea with a teaspoon of sugar or a teaspoon of Splenda? Are they both equally bad to you?
I would rather have them use stevia, which there's not a lot of data on, but it is natural and there's some data, or honey. I would stay away from agave nectar, which is basically high fructose corn syrup when it converts in your body. I think that people need to stop thinking that everything needs to taste sweet. So what I would say is wean them off the fact that everything that you drink is sweet. And you can do that by just like decreasing the amount of sweetness. Yeah, and the artificial sweeteners are not good for you, and they actually don't even help you lose weight either. Yes?
Could you speak to monk fruit?
Monk fruit is really interesting. It's a natural sweetener. It does not change your glycemic index from what I've read. I don't have a lot of experience cooking with it. When I tasted it, I thought it was so sweet. I didn't like the flavor.
I'm sorry, which one was monk fruit?
If you were to pick a stevia, what kind of stevia would you pick? Liquid, powder,
Again, I don't use these sweeteners. Okay. And so I don't have like practical knowledge of it. Maybe someone else does. I use honey and I use maple syrup and coconut palm sugar when I bake, but I don't have a working knowledge of it. Kombucha? Yeah. Kombucha can be really good for you. It can also be really high in sugar. So they also had brain volume data on people that drank sugary drinks. And they showed that their brains, not surprisingly, were not very robust if they had a lot of sugar in their diet. So yeah, please get your parents and anyone else off of that.
Does it show like sugary drink people are probably eating more fried food and like is there a link, like do they?
Probably. Oh, this study did a really good job of controlling for other dietary factors. Okay, what about coffee? Coffee is good for you or bad for you? This has been studied extensively, especially in Europe where there's a coffee drinking culture. 3 to 5 cups of black coffee a day.
Does it have to be caffeinated?
No, it does not, because there are over 200 antioxidants in coffee. And caffeine does have some, obviously some brain activity, but that's not the reason it prevents dementia. Yeah, so coffee is good for you. Great data, 65% reduced risk of dementia. A lot of these studies were done in women and looked at memory. The problem with coffee is what?
The roasting process is carcinogenic.
Well, there's that. That's yeah, it's all the things we put in our coffee. It's the dairy, it's the pump, like the pumpkin spice pump, I don't know what people get when they go to Starbucks. It's all of those things. So I would love for people to get back to drinking coffee black or maybe just a little bit of a plant-based milk. Dairy products in coffee will reduce the antioxidant activity of coffee. So it negates it. So coffee is good for you, but you put dairy in it and it's not so good for you. Yes?
What do you do to take out that carcinogenic effect of the roasted coffee beans that they're now saying?
So dark roasted coffee, I do tend to avoid, although I love drinking it because I have a very bitter, friendly palate. Medium roasted coffee and lighter roasted coffees have less of those AGEs. The other is the way you make your coffee. So a French press, which is basically unfiltered, will have more of those compounds in it. But it's so healthy for you that I don't really worry about that so much. Yeah. I think all the antioxidants are definitely weigh in the balance of it being a brain healthy drink. And I do choose, not so dark roasted coffee anymore. Although I do drink espresso.
Brain health, but you could also develop cancer.
Yeah. But then they did yeah. But I would look at it in all of your diet, not just one thing. So I do drink espresso, and they've done studies in Italy about espresso. And it's the brain healthiest drink in Italy for sure.
Did you say French press was worse or better?
French press is unfiltered, so you're more likely to get those, I don't like to say toxic, but those compounds than others. Yes. Yes. I'm sorry?
Decaf coffee or the benefits the same?
The benefits are the same with decaf. Oh, just mortality, just in general. If you want an endpoint, you look at mortality. I mean, we're talking about dementia and longevity and things like that, but people are less likely to die. They're more likely to live longer if they drink coffee.
You don't want that 18%.
Okay, you guys, I think this is my last slide. So just to sum it all up, a brain healthy diet has a low glycemic index. We all know what that is, right? It's low in sugar, high in fiber. It won't spike blood sugar and insulin levels. It's low in saturated fats, which is not to say you can't have any saturated fat at all, but it's low in saturated fats. It's rich in monounsaturated and polyunsaturated fats, like you find in nuts and olive oil. It's packed with antioxidants. It's plant-rich. It's nutrient-dense. It's not a diet. It's a lifestyle. It's the way you take care of your brain. It's the way you take care of your family's brains.
Where does avocado fall in the category?
Pro-avocado. Yeah. High in monounsaturated fats, 10 grams of fiber in an avocado. So if you're a woman, that's almost half of what your daily fiber is. Wow. Yeah. High in calories, but who cares?
If you follow a vegan diet, what would you supplement for brain health?
Supplements is a tricky thing for me because there's no data that says that supplements are beneficial. But I would make sure that your B12 levels are normal. That's pretty standard because B12 deficiency causes brain disease. I would make sure you're getting enough omega-3 fatty acids in your foods, plant-based. Yeah, and then there's the choline and lutein issue, which you get from eggs and chicken and some other things. But there are some plant-based sources of that. Yeah. Oh, thank you. This was yesterday? I feel like I've been here for so long. I want to thank you so much. This has been an amazing group. Thanks for your attention. I'm sorry we went over. I want to let you know I have a website, and this website is just for everyone. There's nothing for sale on it. It's all just free information. I want you to share it. There's recipes I've developed with my brain healthy ingredients and techniques. I'm on Instagram and Facebook. I also have a free monthly newsletter. And I pretty much scour the literature every month and come up with studies that you might be interested in terms of daily living, whatever is new in terms of nutrition, health, and brain health. And you can sign up for that on my website if you like. Yeah. So I just have a couple of things to show you. As you know, I advocate nut milks and plant-based milks over dairy milk most of the time. I mean, it's controversial as to whether adult humans should even consume cow's milk, right? There's that whole controversy. So just knowing how to make nut milk is just a really good thing to have in your back pocket if you want to have a more of a plant-rich, brain-healthy diet. And it tastes so good. And when I started doing this with my family, I would just make a batch of, almond milk. I would put honey or maybe a date in it to sweeten a little bit. And I would just leave it in the fridge and stop buying milk for a while. And the kids would come home from their soccer practice and they would just drink the whole thing down. And now my husband comes back from hiking and he just drinks the whole thing. But they'll be like, will you go buy some milk? I'm like, sure, I'll go buy milk. Once a week I'll get some milk or some half and half for my husband. But I'm trying to get my family to be more plant-based as well. It's really hard, with my boys especially. So basically what you do when you make almond milk is you take almonds and soak them for 8 hours or overnight. If you're using cashews, you only have to soak them for a couple hours. Other nuts like pecans and pistachios are also softer and they can be soaked less time. And then you drain off the water. You're going to add fresh water to it. And you do need to have a good blender, which is key. This is a Vitamix. There are other good ones. People say they like their Breville's. I'm going to fill it up like 3/4 full. I'm going to add a dash of salt. So this was, so you have the recipe, and I believe it's 1.5 cups of nuts. And then I usually just fill my Vitamix up 3/4 full. I do about 1/2 teaspoon of salt. Of course, if you're salt sensitive, you might not want to do that, right? And then we're having turmeric almond milk, which is sweetened with a date. So I put turmeric in my milk. I put lots of flavorings in it. Cinnamon, spices are really good for you. And there's a lot of data on certain spices in brain health. Cinnamon is one, turmeric is another one. There's a large body of data about turmeric as being a potently anti-inflammatory spice. The problem with turmeric is we don't absorb it very well. So there's different ways you can use turmeric to increase absorption. You guys probably already know about black pepper. So turmeric and black pepper in a 1-to-1 ratio can increase the components in turmeric, especially the curcumin, by 2,000%. And it's 1-to-1, which is a lot of pepper.
You need a lot of turmeric.
I have a granola recipe where I have that figured out, a turmeric black pepper granola. The other thing you do with turmeric is it has to be cooked in a healthy fat. So cook it with ghee or olive oil or whatever it is you like to use, avocado oil. And there's monounsaturated fats here. So it's basically like a turmeric delivery system is the way I look at it. When you're cooking with turmeric, start small because it's got a funky, bitter taste. It's not everyone loves. So there's not a lot of turmeric in this. Oh yeah. There's not a lot of turmeric, but like when I make it for myself, I'm like 3 times more than here. And then how do you keep it from staining everything? I have an orange apron. I use lemon juice on my hands if I get stains. If my Vitamix, if my blender base gets yellow tinge, I leave it in the sunlight, and that gets rid of the stains.
Do you have a feeling about fresh turmeric versus powdered?
I think they're both great. I love fresh turmeric if you can find it. I keep it in the freezer, and then when you grate it, it won't splatter. Use it just like ginger. It's right next to the ginger.
We didn't see it yesterday.
They were
out of it.
They were out of it. There was a run on fresh turmeric.
They knew we were presenting, staying in the fridge.
3 to 4 days. So you should make enough that I think our family will consume.
Obviously, you said your family just drinks it. What else do you use almond milk for?
I cook with it. We're going to make a pumpkin polenta in cooking school with almond milk. You could also use cashew milk. I have a wild rice and farro soup that I borrowed from Ina Garten, and I made it much more brain healthy.
Less butter, I assume?
Less butter, no cream, and no cheese. And I use almond milk for it, and it's delicious. It's because it adds layers of flavor. You get the healthy fats, you get that mouthfeel and that filling feel, but also the nutty flavor is just so great. So I cook with it anywhere I would use milk. And then of course you can put it in your coffee if you want to. Okay, we won't be able to talk for a while. You should like 3 minutes, 2 minutes, 3 minutes.
Could you address that? So when I look at a nutrition label, it says, for example, like quick oats. There's the same amount of fiber in quick oats as there are in regular oats.
Yeah.
Maybe not the 1 minute ones, I'm not sure about those, but the 5 minute. What is the difference between that nutritional value when you're saying?
Well, it varies from company to company. But if the fiber is the same and there's no added sugars and not many preservatives, then I would say it's a pretty good product. I mean, there's an instant oatmeal that I really like. It's called Better Oats. And it's what I eat when I'm running out the door to go on a hike and I need to eat something because I'm not a big breakfast eater. And it's instant. It only takes 1.5 minutes in the microwave. So I think you just have to read the label. A lot of instant oatmeal just has so much junk in it, right? Like, remember dinosaur oatmeal? Yeah. Do we ever actually feed our kids that? Yeah. Dinosaur egg oatmeal. My kids used to beg me for that. They would beg me. But I think instant oatmeal is an okay thing. Yeah. Yes?
What strain is the recipe on here, or?
There is a recipe packet for what I'm doing. Yeah, that's it. I didn't put the turmeric in it.
You did not.
Well, what you're sampling is that we're going to use this in our class tomorrow. And if we run out of this, you can have some. But you can make it with turmeric or without.
It was really good.
Do you like it? So it's very subtle. You can increase the turmeric to your taste. Yeah. And so if you're making almond milk, you do need to have a nut milk bag. And these cost about $4.
I didn't have one. I bought it on Amazon.
Yeah. It's not a big deal.
It came too.
You know how all the meat is left in the bag at the end?
Yeah, the almond meal. They do and they don't. It's You can make almond flour out of your pulp. You have to put it out on a baking sheet and let it dry out, or put it in the oven and let it dry. And I do that sometimes because I don't like to waste food. Sometimes I compost it. Or you can put in granola bars or cookies. And
Dry it out?
I would dry it out. Depends on what you're making. So there is an almond milk machine. Do you guys know what it is? Patty has one. Almond cow. Patty and I have see eye to eye in everything in the kitchen and in life. We both have almond cows, which is like a Vitamix that makes almond milk. And you don't have to do this. So it's like a Vitamix. You put the almonds in this little thing on the inside. You put the top on. The top has a blade. It pulverizes it. But if you go to the Almond Cow website, they tell you about all the things you can do with the pulp, which is really cool if you don't like to waste food like I don't.
So how bad is it to buy almond milk?
So if you buy almond milk, it's not bad at all. You don't need to make your own almond milk. I know you guys. I know you're busy. I know you're busy.
But you need to look at the ingredient list because a lot of times there's additional things in it.
Yeah, so you want to buy unsweetened almond milk. There's also a stabilizer called how do you say it? Carrageenan, which I've seen some studies showing that it's not so good for our gut microbiome. So I would avoid that.
Talks about some of these new appliances that are out.
My friends who have steam ovens rave about them. I would love to have a steam oven because it's the best, moist cooking is really good for preserving the nutrient density of the food. And it's one of the brain healthiest ways to cook. Steaming is fantastic. So yeah, I think a steam oven would be amazing. Yeah, you can. Yeah, I steam in my Instant Pot a lot. I love my Instant Pot for so many reasons. But one thing I do is I steam a whole head of cauliflower, because we do lots of things with cauliflower in my cooking school. But one thing you do is you can just take a head of cauliflower and put it stem side down in your Instant Pot, put a little bit of water in the bottom. There's a steam function, and it's usually 12 minutes for a head of cauliflower. And then you use that water. That water is nutrient dense from the plant. White is actually a pigment in some plants, but the plant pigment ends up looking kind of yellow. And that yellow water, I put it back into my soup or my sauce, whatever I'm making with the cauliflower. So I like my Instant Pot. I like my Vitamix. I'm kind of a simpleton when it comes to cooking equipment. I do love my, my waffle iron, which Patty turned me on to, because I make savory waffles from it. All sorts of things that I spiralize, like zucchini and sweet potato and all that stuff, and you put it in a waffle, and it's just so good. And the whole family eats it, right, because it's a waffle. I also love a pizzelle maker because I use it to make gluten-free crackers. A pizzelle iron. A pizzelle iron, I use it for making gluten-free crackers. Okay, the next thing we're going to make. Has anyone made walnut parm? Walnut parm? Walnut parm. So it's basically, I'm thinking this is a nutrient delivery system that's incredibly delicious, and I hope you love it. I want to put it on everything. It's really easy to make. It's 4 ingredients. It's going to take a couple seconds. It's not meant to replace Parmesan cheese. I mean, Parmesan cheese, right? I love Parmesan cheese. It's probably one of your healthier cheese choices too, because it's low in saturated fat. But walnut parm is walnuts, which has the highest omega-3 fatty acid content of most nuts. It's if you look at nuts and their brain health quotient, walnuts is up here, everyone else is kind of down here. And it looks like a brain. And it looks like a brain, so you can never forget. You add a little bit of miso paste. Do you guys cook with miso paste? Yeah. One of my favorite things to help you eat better is to tell you to eat something fermented every day. And miso paste counts. Miso paste has tons of nutrients in it. The fermentation makes it more bioavailable to your system, and it tastes so good. And then this is kind of a fun thing, nutritional yeast, which I'm sure some of you know about. Nutritional yeast is actually a type of yeast. It's a Saccharomyces something.
Is that like the old brewery?
Yeah. And the thing, if you haven't used it, come up and smell it. It smells like cheese. So it's cheese-ish. I'm not into food substitutes, but it does give things like a cheese-like, aroma and flavor. It's like a B vitamin shot. I mean, it's amazing how many B vitamins are in this. So it's something that's nutrient dense and it's delicious. Because I wouldn't want to eat anything that's nutrient dense that's not delicious, right? There's so many good foods to eat. And then we're going to do a little bit of garlic. So I'm going to make some walnut parm. So this is 2 cups. You have this recipe, right? 2 cups of walnuts. This is a double recipe. 4 4 tablespoons of miso paste. We're going to do a little bit of smoky salt. You guys like this salt? You try that. I'm kind of a salt fiend. I have really low blood pressure, and everyone in my family does too. So if you're salt sensitive, I'm only going to use a small amount so you don't get blasted with it. And then we're going to put some garlic in it. Are you guys getting hungry?
Does toasting your walnuts minimize or deplete the nutrients in them?
You know, toasting walnuts it's a really important question because most of the nuts you buy, if you buy them already roasted, they are going to be a lot higher in AGEs, those AGEs we talked about. So I advocate that you buy your nuts raw, if at all possible, and then toast them right before you use them. Yeah. No, it doesn't ruin the nutrients or anything like that. You can cook nuts and it'll be completely fine. Yeah. These are raw. Yeah.
But if you toast them at home in your toaster, or you roast them and have to pan dry them, aren't you adding those yourself?
Yes, you are. But you know, everything you do to food, except for eating it raw, is going to add some AGEs. So if you start with a nutrient-dense food that's inherently low in AGEs, you're going to add some. It's sort of like, you know, death and taxes. There's no way you can get around it. But if you start with really good foods to start with, unless you want to just eat everything raw, that's fine too. But I live in a cold climate. I have to eat everything. Is there a top to this? No. Okay. So we're just going to pulse it until it looks like sort of a crumbly granola, like a wet granola. This is a nice food processor. Yeah. And so you can kind of, you know, push together your fingers. See if I add enough salt. It's so good. It's so good. You can put that on so many things. So who has one of these machines? Spiralizer? And how many people actually use their spiralizer? Occasionally? Good, good. Does anyone not know what this is? It's a way to turn vegetables into noodles. And there's nothing I love more than pasta, but you know, eating more vegetables than pasta is definitely a good thing for our brains, right? So I think most people just don't really know how to use their spiralizer, or once they spiralize their noodles, what to do with it. So I'm just going to spiralize a few things. We're going to cook it up in some olive oil, and then you can taste it all with the walnut parm. How's that sound? So one thing is when you purchase your vegetables at the farmer's market or wherever, if you buy like a crooked squash like this, it's not going to spiralize very well. So once you get into spiralizing, you start looking for vegetables based on their spiralizing ability. And so you're going to do better with a straight vegetable. Don't start off spiralizing something like butternut squash. It's really hard to spiralize. You can do it, but you know, the entry-level vegetable is the zucchini. Okay? You can buy the butternut squash. Exactly. Exactly. And I'm not sure which setting this is. Let's see. So I have a spiralizer very similar to this one. I like the OXO one the best. The most important thing as a doctor to know is that you don't want to put your finger through that. There are spiralizing injuries that all over the country in ERs now that are really bad. You don't want to touch the blade at all. You certainly don't want to like try to push the food through the blade. That's bad. Another really important thing for success is all of these have some sort of a suction cup device. It's not going to work on here. It's not going to work on wood. It needs a countertop or some sort of granite, and it needs to be really firmly suctioned to the counter. Okay? Yeah, that's the one you have, right? That goes on your KitchenAid? Yeah. So when you take this off, you don't want to touch the blade. You don't want to pull the food out of the blade either. So this makes pretty fat noodles. And I think we're going to do smaller noodles for the next one. Oh, yeah, you can go. Oh, there's that bowl, that big. Oh, I did. Okay. So people always tell me they don't have time to spiralize. And I'm like, well, I can spiralize faster than I can make pasta. So do you cook your noodles, your zoodles, or do you eat them raw? You cook them? You can do either. There's a sesame noodle recipe on my website where the sauce actually kind of cooks the noodles. So you just skip a step and you can just toss it with it. It's got sesame oil and some other things in it. It just really kind of poaches the noodles just right. So easy, right? Yeah. Sure. And so what about cooking with olive oil? We had some olive oil questions I didn't answer. Some people say you can't cook with it because it's high in polyphenols and antioxidants, and then heat degrades all that. And it's actually, it's true, but you can't not eat olive oil, right? You have to cook with it. And certainly there's traditions all over the world where they cook with olive oil primarily, like in Italy and Spain. So you just have to be really gentle with your olive oil. You don't want to cook it at a high heat. You don't want to put it in a pan that's searing hot. You don't want it to start smoking. That's what the smoke point is. There's a certain smoke point for all different oils. If you heat it above its smoke point, not only do the healthy fats break down, but those polyphenols become inactive. And sometimes, even some oils, you will start to get, things that are unhealthy for you. So this is how I do it. And I'm sure a lot of you do the same thing. I heat up my pan first, not super hot. And then once the pan is warm, I add the olive oil. And then once the oil just starts to shimmer, so I do try to keep an eye on it. I do occasionally walk out of the room, do something else. Try not to do that. I try to keep an eye on it, and then I add the food. As soon as you add the food to the olive oil, the temperature of the oil goes down. So you're protecting it. You're trying to keep it as healthy as it is. Does that all make sense? When you bake with olive oil, the internal temperature of the olive oil does not go up that much. So it stays on, even if you're baking a cake, say at 400, the olive oil will still be like under 350. So when I read a lot of the food science studies, so you guys don't have to. And that was one of the best things I learned is that, when you bake with olive oil, you can feel really confident that you're not destroying the polyphenols and everything else in it. So it's just getting a little bit warm. Ooh, this is fast. We got this at the farmer's market yesterday. This is local olive oil.
We had so much fun at the farmer's market. We met every farmer. We had a list, like 2 pages long.
Yeah, we got her done.
Yep.
So how do you choose olive oil at the grocery store? What's the most important thing? First press, cold press. There's a lot of marketing terms around olive oil that are basically meaningless, unfortunately. What you want to look at is the harvest date on the oil. And I'm sure this one has one. It's local. I mean, she told us it was from last year. But there's a harvest date. And so it's kind of like buying wine. You want to buy olive oil that was harvested at the farm. Because when you get into trouble with fraudulent olive oils, you've read about that, right? Where a lot of the supermarket oils, as much as 2/3 of them, it's kind of like the fish. 2/3 of them are not what they say it is. So when you buy olive oil like that, it's because they might have been shipped in a tanker from the Mideast and from Greece and from Spain that are inferior quality oils. They're not even olive oil. They might be seed oils, which are actually bad for you. And then they ship them to Italy, and they bottle them there. They mix them with olive oil to give them the flavor, and then they say bottled in Italy, right? So a lot of olive oil. See there, it's starting to smoke. Oh, we need to cut those, sorry. I forgot. The most important thing is like the scissors.
We have the scissors, right? Yeah.
So I have gotten to the point where I don't use white flour in my kitchen anymore at all. The closest substitute is white whole wheat flour, which white wheat is a variety of wheat, but it has a lot more fiber than processed white. And then a lot of my baking, I try to use almond flour, hazelnut flour, other types of flour. Oat flour, I cook with chickpea flour a lot.
Are there one-to-one substitutions, flours, when you bake?
It's not. You actually have to play with it. Yeah, it's a little tricky. A lot of times I will use a little bit of white whole wheat flour with a gluten-free flour. But there are some good gluten-free flours out there, right? Like the 1-to-1 brand is really good. Thomas Keller's brand. What's it called? Cup per cup? Yeah, that one's good. Oat milk. You know, nuts are expensive, as you know. And so you can do the same thing with a cup of oats that you soaked in water. And you'd have a whole, you know, like 6 cups of oat milk. I think it's fine. I don't love it. It's fine to substitute for dairy if you don't want to do dairy. I certainly wouldn't spend a lot of money on it at the grocery store. You can make it so easily in a blender. You soak the oats, not even for that long. Then you put the whole soaked oats in the blender, add more water, a little bit of salt. You don't have to strain it. I don't like the texture so much. Do we have some plates? Here, let me get those. So we're going to have a little bit of walnut parm.
Maybe we let everyone put their own walnut parm on. Should we do that?
Yeah, absolutely. So another thing you can do with zoodles is like I cook a lot of fish in packets, like in parchment paper packets. So you can do like take the raw zoodle, whatever other types of vegetables you've spiralized, put it in the bottom of the parchment paper, lay fish on top of it, squeeze some lemon or some orange juice over it, salt and pepper, olive oil, put it in the parchment and seal it and put it in the oven. That's a really easy one-dish meal.
All right, come grab what you guys want.
You can try these raw too. You don't have to have them cooked.
Maybe we'll have everyone just come up and grab.
Yeah. Yeah, come on up. Sitting is not good for you. You know that, right? Another thing that you can do is sometimes I'll just take the raw zoodles and I'll make little nests out of them and put them on a baking sheet and then top them with like a mushroom bolognese and put it under the broiler real quickly. And that's a really fast way to cook them. And then sometimes I don't cook them at all. I just toss them with whole grain pasta.